Good afternoon, and welcome to blackdoctor.org. I am Ellis Dean, a senior project manager with blackdoctor.org, and we are excited to have this discussion with you all today, to bring this discussion to you all today. As you all know, that over the past several months, and COVID has really kind of dominated the headlines in 2020, and not only COVID, the actual disease, but the vaccine and the rollout of the vaccine, and how the vaccine was developed, and really the push on getting Americans to be vaccinated from COVID. And so when that happens, and we're talking about it in the context of Black Americans, an ugly past comes into play, and that is the Tuskegee syphilis study, also known as the Tuskegee Experiment. And we haven't really had the opportunity like this to discuss the Tuskegee Experiment and its implications then in 1932 when the study began, in 1972 when it was made public, and now here in 2021 where, what advances have we made, and what lasting implications that particular study has had, not only on medicine in a broad sense, but for Black Americans and our participation and our involvement in the medical profession. So I'm going to play a short video really kind of discussing the Tuskegee Experiment. And then when we come back, we're going to have two medical professionals that are well accomplished, that we're going to really have a robust discussion. And we'd love to have your comments, a robust discussion about the Tuskegee Experiment and where we are today with regards to the COVID vaccination. So here's our short video, and then we'll come right back.
They were told they'd get treated for their bad blood. Instead, hundreds of poor Black men became participants unknowingly in a shocking and truly shameful chapter of American medical history. In 1932, the United States Public Health Service launched an unethical research project to examine the effects of untreated syphilis. The project was called the Tuskegee Study because it recruited 600 Black men living in Tuskegee, Alabama. Researchers told the men that they were being treated for bad blood, a term used locally to describe anything from fatigue to anemia. They promised the men free medical treatment if they participated. While 2/3 of the men in the study were confirmed to have syphilis, not one received proper treatment for the disease they had contracted.
So this was a study in which there was no consent on the part of those who were being studied, also deception on the part of the U.S. government.
When penicillin became the recommended treatment for syphilis in the 1940s, Tuskegee researchers scandalously withheld the drug from the men in the study so that they could continue to chart the course of the disease when untreated. Many patients experienced damage to their vital organs and nervous systems, and for some, the lack of treatment led to death.
The great shame of the study is that the men thought that they were being treated. Treatment was withheld from them, even after it was very clear what kind of medical treatment would cure them of syphilis.
In 1972, an Associated Press article exposed the Tuskegee study after one of the participants brought the story to a civil rights attorney. Only then, after 40 years, was the study brought to an end. The case was settled out of court for $10 million.
This long history of medical experimentation on African Americans creates a sense of distrust. A distrust of doctors and physicians, a distrust of medical care.
In 1997, President Bill Clinton formally apologized to the victims of the study. The president's apology was a welcome first step, but we still have a long way to go before the legacy of mistrust of science within the Black community is fully overcome.
Well, that was Henry Louis Gates, as we all know, and he kind of gave a history. So I'm going to bring on Dr. James Gavin and Dr. Lenore
Just make sure
Coleman.
I'm up on live events. Wait.
We're going to bring on Dr. Lenore Coleman and Dr. James Gavin here to really kind of discuss the Tuskegee experiment, what happened, and where we are today. So, Dr. Coleman, as we get Dr. Gavin connected again, Dr. Coleman, when you watched that video, what is your first response? And when you first learned about the Tuskegee experiment, what was your first response?
Thank you so much. I wanted to, thank you so much for allowing Healing Our Village to be able to participate in this program today. So the audience sort of knows a little bit about me. I am a pharmacist by training, a certified diabetes educator, and actually worked within the pharmaceutical industry as one of their scientific liaisons for about 6 years. And in that working within that industry, I learned a lot about clinical trials. And what my job is to try to reach out and educate the community regarding clinical trials and actually help some of the trials that we were involved in to get more minorities. Currently in this country, there's only about maybe 3% of people of African American and African Americans that are even enrolled in clinical trials. So as we look at all drugs, all vaccinations, all these types of things, because of the lack of African American participation, that has always been a problem. And so that was what I actually did and have been doing over the last 6 years or so. So we learned a lot about that, because when we went out to the community to talk to people about, participation in clinical trials, one of the first things that always came up with African Americans, well, I'm not trying to be a guinea pig, and I'm not, remember what happened with the Tuskegee trial. And so I'm very familiar with the study. I'm very familiar with what happened when you're talking about that particular study in the context of what's happening in 2021, okay, with the COVID epidemic and the vaccination. It's apples and oranges, because we're in a different time period. The level of knowledge is different. The number of African American scientists and professionals is hugely different in terms of just volume, numbers that are out here who are aware of and experts in this particular area, either functioning as clinicians or as scientists. So yes, the Tuskegee experiment, and I usually, it really was, United Public Health Service was really the study, right? So really wasn't Tuskegee, but that's okay. I realized it was terrible, but those are actually in the past, and things are much, much different now. And so I don't think that there would be any way for that to happen in 2021. I just don't think we're too, as they say, woke, right, to have that kind of thing happen. So that's sort of where I'm at in terms of the context of our discussion today.
Dr. Gavin, the question I posed to Dr. Coleman was, after watching it, and when was the first time you learned about the Tuskegee experiment, and what was your first response when you learned about what happened in Tuskegee so many years ago?
Thank you very much, Ellis. It's a pleasure to join you and Dr. Coleman. I'm a native of Alabama. I was born and raised in Mobile. And so the Tuskegee study was something that was very much present and an item of discussion for us, even in our early years. And of course, what we extracted from that was summarized very nicely by Lenore, because I think clearly it was one of those Nazi-like invasions of the integrity and health and safety of a community, a population of people. Reprehensible. It violated every known moral and ethical code, and it was even in violation of the Nuremberg Code by the time that code was written post World War II. But clearly, what we understand from that study was that at that time of the Tuskegee study, and Lenore is very correct in pointing out that this was a study of the United States Public Health Service that was performed in Tuskegee. At the time of that study, all of the owners of scientific information, all of the deliverers of medical care, all of the healthcare policymakers and the guardians of healthcare quality and safety for patient issues, all of those things were invested in the hands of white males, by and large, who were indifferent to the value of Black lives. And of course, there was a long legacy that came from that, and that was this mistrust of medicine in general, especially mistrust of medical research, and a mistrust of healthcare providers, particularly healthcare researchers who don't look like us. Now we have actually framed solutions to many of those barriers. And I think that's why you're hearing us say that important lessons come out of the Tuskegee experiment, which is what it was, a dastardly experiment. But those are lessons that have led us to where we are now, which is a much better and different place. And COVID-19 presents us with a very different profile of what we can now do and should do to prevent a major and dangerous disease, which for COVID, unlike syphilis, a treatment was developed. We don't have a treatment yet for COVID. We simply have to focus on prevention.
Absolutely, absolutely. And when we're talking about what happened specifically in that study, you're absolutely right. When we're in 1932, there was very little regard, if any, for Black lives. And so, and we're not saying that there is so much more regard today, because as we know in this year with Sandra Bland and James Garner, and we can go down the line, we understand that the fight for value on Black lives is still ongoing in 2021. However, in 1932, we can only imagine, many of us can only imagine what it was like then. If we think it's bad now, it was worse back then.
Oh yeah, much worse.
And there was no Black voices to be heard. We couldn't even speak up and speak for ourselves in that particular study. And I think many times the context of the study has to be framed properly in order for us to really kind of understand it. When we talk about the context of the study, the context is they had misconceptions about Black people, Black bodies in general, and they used this study to try to verify their own misperceptions and misconceptions. And that's what the impetus of this study was. And they did many things along the way, dastardly things along the way, to try to continue that thought pattern, going. Now, going forward, here we are in 2021. So my question for you, Dr. Gavin, is how do you tell our audience it's different now versus what happened in 1932?
And I think, Ellis, that is really the key question. So first and foremost is that we are now talking about a system of clinical research, and that's what this Tuskegee study was. It was a clinical research study. It was just done under all of the worst possible conditions. But the system in place for clinical research right now is totally and completely different. There are now safeguards in place. There are legislative safeguards. There are patient-based safeguards that are in place, so that anybody that wants to do a clinical study to find out whether a drug or a treatment intervention is safe and effective, you have to go through hurdles. And these are hurdles that now we are aware of. We are at the table. I chaired myself the Data Safety Monitoring Board for the VA Cooperative Study in Diabetes for 12 years. I was on the Data Safety Monitoring Board for the Diabetes Prevention Program. We have now well-placed persons like myself and Dr. Coleman in the entirety of the clinical research infrastructure. Legislatively, you have to have institutional review boards to even speak to whether or not a study is going to be allowed to go forward. And at every step, you have to have levels of transparency about what is going on in the study. What have you found out about its safety? What have you found out about its efficacy? And that information is publicly available. Anybody in our audience today can go into the record now, can go online and find out who was in the studies that were done on the COVID-19 vaccine. What percentage of African Americans, for example, turns out to be 25%. Lenore talked about how little the representation is in many studies we have. We know for certain studies like this, you need to have over subscription because of the vulnerability of the patient. So all of these safeguards are now in place, but more importantly, the information that is being generated, the people who are participating in these trials are people that look like us. And we were not always at the table. We are very much at the table now, and we make sure that the veracity of the information that is being conveyed to our people is absolutely pristine.
Yeah.
Dr. Coleman, it's been estimated that once the results of the Tuskegee study were revealed, that it lowered the life expectancy of Black men, or Black people, I think I want to say Black men, in this country by 1.4 years because of that distrust. You have participated in seeing clinical trials and clinical studies executed. What do you see, and how do you see us bridging that gap to where there is some level, a higher level of trust between the Black community and the medical profession?
Yeah. So that's such a good question. So this is my I guess sadness with this. The fact that it is so difficult to get African Americans to participate in clinical research means that when a new drug or a new therapeutic or even a new device comes out on the market, we don't have the representation of the African American population in that study. So let's say, for instance, a drug is being studied for the management of hypertension. Well, African Americans have the highest rate of hypertension in the world, yet they're not in the studies because they distrust the study. And therefore, we don't know if that drug that is going to be used for a disease that they probably have or someone they know has, we don't know if that drug may work in them. It may not work as well in African Americans as it works in Caucasians. Or even yet, maybe it works better. There was actually a drug called Bidil that was used, that a study was done for the treatment of heart failure. And it was a study that overpopulated the number of African Americans. It was called the African American drug for heart failure. And what that study showed was that particular combination worked better in African Americans than it worked in Caucasians. So because we're not allowing ourselves to participate in these trials because of distrust, because of this concept that you're a guinea pig, that now is making it so that when in fact that drug comes to market, we don't have the data that we need to see if it works as well. Is the dose, should it be different in African Americans? Maybe it works better in African Americans. We don't have that information. I also wanted to just make a comment again on the two important things. I don't want this to get missed. That data safety board that is on every clinical study that is done now, they actually get to see the data. See, most studies are what they call double blind, so that the patient doesn't necessarily know what they're getting and the clinician doesn't know what they're getting. But the data safety board does. They're able to see the data. So if any kind of side effect or any kind of increase in deaths or whatever may pop up, that data safety board is privy to that. So that's why when we're talking about these vaccinations, both of those studies have that board on site. In fact, you saw in the news that the AstraZeneca study had to be stopped for a minute because there were some things that had popped up and they needed to be reviewed. They did an in-depth review, and that study was allowed to continue. The other thing that I wanted to mention that Dr. Gavin said is this idea of informed consent. This is a huge thing that came about because of the Tuskegee experiment. So now before a patient is even allowed to be in a trial, they're giving this very, very detailed in easily understood language, what the study's about, what the potential side effects are, what is the risk, what is the benefit. There are all sorts of pictures and handouts and all sorts of things that are done so that that patient, when they consent to participate, they have full knowledge of what the expectation is, whether they're going to get the study drug or they're going to get the placebo. So I think that that is so important for people to understand.
Can I just add quickly to that, Ellis? Because the Data Safety Monitoring Board that I mentioned that Lenore just talked about, the Diabetes Prevention Program, which was the biggest federal study for the prevention of diabetes that has ever been done. I was on that Data Safety Monitoring Board. One of the drugs that was used in the original design of that trial was a drug called troglitazone. Absolutely excellent drug in terms of its effectiveness, but it had a problem in terms of damaging people's livers, and it was responsible for the death of a person. We saw that data and immediately moved, I and another endocrinologist moved to get that drug removed from the study. That is now what we're able to do by being at the table. And that's why this is so important. We don't have these kinds of things that get by anymore. And I think people should be reassured by that.
Absolutely. I guess my question for either one of you is, how do we find a healthy dose of not forgetting? Much like our Jewish brothers and sisters don't forget about the Holocaust, but they have moved on but they don't forget, but they're making sure that nothing like that ever happens again. How do we find that space as Black people to say, we're never going to forget about the Tuskegee experiment? I teach my children about what happened with that Tuskegee experiment, but I don't want it to cripple them to where they don't participate in their own lives and in the moving forward of Black people. How do we get our audience to find that nice space of not forgetting, don't let it freeze us and not participate in clinical trials?
I think that is really the heart of all of this discussion and what's happening right now in this space about COVID. Because one, a healthy dose of suspicion is a good thing because Tuskegee actually happened. But the fact of the matter is that those people at that time didn't know enough to be suspicious. They had no suspicions. We now have a great deal more insight. So we have to remember the lessons of Tuskegee so that we are informed in the way we think about things. Because if you have the appropriate level of suspicion coupled with the right level of knowledge and insight about what has happened, you ask the right questions. And that's why we should encourage people to ask questions, but not let that be a barrier to participation, because you can't effectively use what we don't know if we don't have the appropriate knowledge about it. If a drug, like Lenore pointed out, if a drug hasn't been demonstrated to work in you, you can't really use it with much assurance that it's going to help you. So you have to be part of framing the solutions. And that's the package that we have to deliver. Suspicion coupled with appropriate knowledge so that you can ask the right questions and make sure that there is accountability from those who are asking you to be a participant. And that's basically what we're trying to do with everything that we're doing right now.
Exactly. So, I'm sorry. So the studies have been done, and there's a few studies that are still ongoing. I don't know if any of your audience out there, but I actually watched that FDA advisory board meeting. I watched it. So I could see what these world-renowned scientists that were not being paid by the pharmaceutical companies, that were totally independent. I watched their deliberation and their look at the data. This is data. This is black and white. This isn't something that's made up out of the sky. I watched them look at that data and come to the conclusion that the vaccines that have got that emergency use authorization, that those vaccines, the risk versus the benefit of bringing those vaccines to the market as quickly as possible was so overwhelming that that advisory board agreed to make that recommendation to the FDA, which then goes back and takes that recommendation and evaluates it some more before they then give their blessing. So you can be assured that when I'm just waiting. I can't wait to get my vaccination because I need to be sure that I know that the data was good. I feel comfortable about that. And as soon as I'm in the next tier of people who can receive the vaccination, I'm going to be the first in line, because this vaccination clearly is going to keep you from dying. And I'd like to live for another 30 years if possible.
And to that point, I've already got my appointment. I'm scheduled to get my vaccination on Saturday. I'm looking forward to it. I've followed the data closely. But Ellis, you know what? We also need to make sure we give people the tools to find the kind of information that's out there. The data is out there, but you have access to it. You can go online to clinicaltrials.gov. You can go online to johnshopkinsmedicine.org or the edu, and you can find out what those data are, what the studies are, and how it applies to you as a person of color, as an older person, as an obese person. So those are the kinds of tools that we need to make sure anybody that has the sophistication to go on social media, they can go online and find out this kind of medical information as well.
Exactly.
Well, we've done that at Black Doctor. I'm going to do a shameless plug right here. We've done that at Black Doctor. We have a COVID channel. We have a COVID information, and we're updating it daily. We do keep track of the number of deaths, and that's really important. And it's important for Black Americans to understand that even though I think I saw in one of the comments earlier on the promotion of this, that they said, well, Black people are only 18% of the COVID cases. And yeah, that's true, but we're dying at but we're 13% of the population. So that means we're getting it at a higher rate, and we're absolutely dying at a higher rate from complications due to COVID-19. And I also want to clear that point up. People don't die specifically from COVID-19. They die from the complications brought on by COVID-19. So they may die of something else, but it's complications from them contracting the virus. And so we have to be very, very specific about that language, so people don't say, well, I died from COVID. No, you may have died from complications, COPD or something in your respiratory issues, like the doctor in Indiana, Dr. Moore, that passed away tragically. So we do have to give the context for people and understand that there is information. You're right. There's information. There's a whole lot of conspiracy theories about the vaccine, about what's going on. But there's also a whole lot of real, honest, factual information that you can find from trusted sources. And we'd like to think that BDO is one of those sources.
Right.
So Tuskegee happened. And just to give the full robustness of the story, there was a young scientist there in the 1960s as the study was continuing on, that saw it and realized it was unethical, brought it to his superiors, and they basically were like, okay, we understand that, and they chose to continue. That young scientist was dissatisfied by that. He felt compelled by his moral obligation and leaked the report to the press. And that's how we found out about it was printed, I believe it was November 16th, 1972, that the study was printed and the world found out. And then, of course, it was subsequently shut down after that. Now, part of the tragedy is that the family sued and they received $10 million. And so we say in 1972, yes, $10 million is a lot more than it is today. For what those families endured, we're talking about wives got it, children got syphilis. We had people that had mental illnesses, suffered, damage that they didn't need to suffer from. I think $10 million is a little bit small amount for those families. what we have to understand going forward, and what we need to, and about, and I'm going to get to some of the audience questions, but please stick with us because there's a lot of questions about the COVID and all and, and the implications on COVID. And so, but I really want to kind of wrap up the past with regards to the Tuskegee experiment in terms of, we know about Henrietta Lacks, we know about the Tuskegee experiment, we understand that the the father of gynecology has been known to experiment on Black bodies without anesthesias. We understand that there were hysterectomies that were performed without informed consent. That was all in the past, and we understand we don't want to forget what happened, but we understand that is the learning tool that undergird the Black medical professionals today. Dr. Gavin, as a Black doctor, how important is it to you to make sure that you are standing in the gap for Black Americans when you are practicing medicine?
Well, as a Black doctor, I consider that it is part of my professional, my moral, my ethical responsibility to represent people who look like me, who have been underrepresented in this space. So I have first and foremost an attitude of advocacy for all patients, but for particularly for those that have been victimized in the past. So that's why we have, quite frankly, an organization like BlackDoctor.org. Okay, that's why we have the National Medical Association. That's why we have the Association of Black Cardiologists and the Association of Black Nurses, because the fact of the matter is that we have to incorporate into our ethos that kind of mindset, that we have to be standard bearers. We have to stand as guardians to make sure that these kinds of excesses and these kinds of disproportionate impacts on our population are not permitted. And that means we make sure our patients know what is appropriate and how to make sure that they get the best possible delivery of these kinds of services and information.
Yeah, I just want to also mention that Healing Our Village, we've been in operation now for about 25 years. I started in the area of health disparities because my pastor died in the pulpit of sudden death. He had diabetes, he had high blood pressure. And so if in fact you see information, there's questions, I'm hoping that you're getting your information from blackdoctors.org and from reliable sources. But if you have questions, that's what Healing Our Village is here to also help with on the consumer side. The consumption of correct information. And you can call our 800 number, 800-788-0941. We are here right now during this time period, focused on making sure that people have the right information, that they can interpret the information that's out there, making sure that what they're getting is accurate. And we're here for those patients throughout the country and throughout the world, because we do global health as well.
Absolutely. So I'm going to start shifting to asking some of the questions that are coming from the people that are watching. For the most part, they have been very, very pleased and the fact that we are trying to address what happened with Tuskegee. And I think it's important for us to really recognize it as people that as medical professionals like you are and at Black Doctor, when we talked about this, we wanted to make sure that we give the proper context. And I think context is very, very important at any point in time in history, because the context of 1932 was not the context of 1972, and it definitely wasn't the context of 2021. And so when we're talking about what happened in history, we have to apply the context of that moment in time, much like we have to apply the context of this moment in time. So that being said, I'm going to start pulling up some of these questions here that are coming from they love the fact that you said suspicion coupled with the right knowledge of Dr. Gavin. That was very important, that we do have to still be suspicious, and a healthy dose of suspicion is a good thing. Let's see. Here's a question from Elaine Harper. Should I get tested if I am exposed potentially to COVID? And when should she be tested?
Well, if you've been exposed, then the best advice with respect to getting tested is several days, 3 to 5 days after that exposure. If you expect for that test to give you information about whether or not you've actually been affected by the virus. Being exposed and then going and get a test the next day is not likely to yield a lot of very useful information. That's the general wisdom. If you've been around somebody that's given you a huge viral dose, I mean, somebody that's really sick and spraying, then you might want to get it done sooner, a couple of days. But the general information is that to get the most effective information, 3 to 5 days is a good test interval.
I'd like to also say, if you're symptomatic, and this whole idea of symptoms is interesting to me, because I've been talking to a lot of various patients that actually were COVID positive, tested COVID positive. And the interesting thing to me was, as Dr. Gavin said, there's about a 3-day or so sort of what we call incubation period for you to have enough viral load for you to test positive. But the interesting thing that came up when I were talking to some of the folks is everybody's symptom is different. So there were a lot of folks that, had a headache and just discounted it as, maybe they weren't drinking enough water, or maybe they were just getting a cold. And then 2 days later, they lost their sense of smell. Or 2 or 3 days later, they started feeling sort of tired and fatigued and achy. Or 2 or 3 days later, they started getting congestion, both in their chest and in their upper respiratory area. So the sort of when to test, I think is so important. But I think people need to test. I have had talked to so many people who don't. I'm not having anybody stick nothing up my nose. What is that about, people? Seriously. Okay. The test is available. The tests are accurate. The reason why we're in the state of affairs here in this country, worse than any other country, is the other countries did countrywide testing. And so they were able to not only test, but they traced, and they were able to then shut it down because of that. So I think testing is so important.
I think we mentioned earlier in the broadcast about accountability. And so the question that I have, and I'm kind of mashing together some of the comments, is that how do we hold our medical professionals accountable when it comes to the vaccine or any other kind of treatment that they try to, prescribe to us? Because ultimately we know that there's only about 5% of doctors in the country are Black doctors. And so most Black people are being seen by a doctor of another ethnicity. So how do we hold them accountable to make sure that they're meeting the needs that we have?
So I think one of the things that Lenore has been pointing out appropriately, at Healing Our Village, one of the things that has been a key focus at Healing Our Village is patient empowerment. And you're right, Ellis, that we constitute a relatively small percentage of the healthcare providers. But the fact of the matter is every patient should be empowered with the appropriate information and mindset to know that, you know what, you need to ask questions. It is your right. It is your expectation to ask questions, and it is in fact the obligation of that provider to give you answers. And if not, you know what, you got a different set of issues to deal with. And so we try to make sure that patients have the appropriate information. Obviously, you need an informed healthcare professional community, and that's an ongoing process. That's what we're trying to do in part now, by making sure that the providers have the information so that if they're asked a question, they can give the right answer. But patients have to be the catalyst. They have to prompt that accountability by asking the question and insisting on appropriate information in a timely and repetitive way.
Yeah. We focus on diabetes and hypertension. And the thing that, and as I mentioned earlier, hypertension, African Americans have the highest rate of hypertension in the world. That is what we're dying from, strokes and heart attacks. It amazes me that these folks that have had high blood pressure for years have no idea what their number is supposed to be. You're talking about holding your healthcare professionals accountable. Well, the way you hold them accountable is you need to know what your number is supposed to be. And then if that doctor is prescribing medications for you and you're not getting to your number that you're supposed to be at, your goal number, then you need to hold that doctor accountable. You need to have a conversation about, hey, doc, my blood pressure is still 160 over 90. And, Doc Coleman says it's supposed to be, 130 over 80 or less if you're African Americans. What are we going to do to get to my number? And that's not happening.
And I always ask patients, you know what, take a notepad. You need to make sure if you get a number, write it down. You can't be expected to remember all of this stuff. And don't be intimidated by the fact that you might make some provider uncomfortable by taking notes. Oh, no. People take notes about their cars. You owe it to yourself to really take the empowerment responsibility seriously.
Dr. Coleman, there's a question that says, why do we need to stick a swab up our nose so far to be tested for the COVID vaccine when we can catch it from just speaking to each other, and the spittle particles can cause us to be infected? Why do we need to test with the stick up our nose to be crude?
Okay, so I'm gonna talk to you as a female who may think that I might be pregnant. Okay, what am I gonna do? I'm gonna go out and get me a pregnancy test, right? Okay, folks are worried about sticking a swab up your nose for a second, okay? But obviously you're not a female who had to go to a gynecologist, okay, and got in the gynecological exam and talking about what ends up happening during that exam. So I just don't understand why people are worried about a tiny swab. That is the most effective way to know if you have the virus. There are other tests that do not require that, but they're not as accurate as the test where you do the swab up your nose. I get tested since March when this whole thing started. I've been tested 2 or 3 or 4 times. Okay, I need to know my status. I need to know since I'm working with patients, I need to know if I'm positive or negative. I'm not guessing about that. So I, thank God, have been COVID negative. But I know I'm negative because I've had the test multiple times. Because the issue is, as that person said, if I get tested today and I get the results back and I know that I'm negative, and then I go to a bar and I'm hanging out with a whole group of people, or I decide to go to Thanksgiving or Christmas or New Year's Eve party, well, then I don't know if I'm still negative because I put myself into a high-risk environment where I didn't distance. And that's the issue.
And Ellis, they talk about Willie Horton, the old bank robber. I rob banks because that's where the money is. Well, you stick that swab up your nose because you want to get enough virus to know for sure whether it is there in you or not. And that's where it's going to be. There are other tests, as Lenore talked about, but the likelihood of getting a positive, if you are positive, is better when you use a source where the virus is going to be hanging out.
Absolutely. Thank you for that graphic description, Dr. Coleman. But I'm sure with our female viewers, they understand exactly what you're referring to. We can only imagine. Dr. Gavin and I can only imagine.
Yes, we'll leave it at that.
You're gonna leave it at that. I know.
But I have had the old prostate test, so that.
Oh yeah.
That's
Let's move on to COVID.
So that was about as invasive as I have had in my lifetime. So I will say this is that you're right. There are two types of tests, and y'all can correct me if I'm wrong on this. There's the swab test it gives you a snapshot of where you are at that point. And there's an antibodies test, which that test takes a little bit longer to get the results, but it also tells you whether or not you've had COVID, because you can be asymptomatic with COVID, but if you get the antibodies test and your body shows that you've had antibodies developed, that shows that you may have had some exposure to COVID as well. Is that an accurate description? I want to make sure that I see some heads nodding, so that's that's good to know. So understanding your status, much like anything, much like I remember when the HIV craze was going on and people that were in high risk groups, there was a lot of campaigns that talk about know your status. That's the same way where we're talking about with COVID, is that if you're in a high risk group like African Americans, like Black Americans are, if you're in a high risk area where you're living in inner cities have shown to be high risk areas with dense populations or high risk areas, if you know that you're in a high risk population or a high risk area or in a high risk profession, if you're in a frontline employee that have had to continue to go into work to be exposed to a lot of people, it's best to go ahead and get tested. That those few seconds of discomfort with the swab is going to give you some peace of mind to know that you're not infected, or you're not infected your loved ones and family and friends when you're around them without the mask on. So that's my spiel for being, we lost Dr. Gavin, but that's my spiel for going ahead and surviving the discomfort.
Yeah.
Here's a question. Is it true that the antibodies can only be detected in the body for 30 days?
Okay, so I don't think that we know the answer to that question yet. There's a couple of questions that we don't know the answer to. How long your immunity is good for, right? So let's say that you were exposed, your body was healthy. Let's say you were a young, healthy 25-year-old, you were exposed when you went to your college campus, your body immune system was able to keep you from only having either mild symptoms or no symptoms because you had a great immune system. How long does that immunity last? We don't know that. All right, so that's a question that we don't know. We don't know how much of a viral load has to be present for you to be a spreader, for you to spread it. Is it a small amount or does it have to be a large amount? Do you have to be symptomatic to be considered a spreader? I don't think that's true, because we know that there are people who have no symptoms. All right. Once I've gotten the virus, can I get it again? Okay, so let's say that I had it and my body was able to get a good immune response. Does that mean that I can't get it again? I don't think that we can say that for absolute 100%. So because this is so new, this is the kinds of things that are going to be happening, I think, over the next 6 months. We need to get everybody vaccinated, mainly for no other reason that because we have so many people that are sick, requiring ventilation, ventilators, oxygen, having to go to ICUs. Our ICUs are overrun. And I know this for a fact because my brother fell and fractured his hip. We had to go to the hospital. They treated him in the hallway in the emergency room. So when they say that these hospitals are overrun, they're using the gift shop and the chapel in California. That's crazy. And so we have to get the vaccine so that the level of severity of this virus can be tamped down. So people are not having to get extraordinary measures.
Yeah, and I think that's an important point to make, is that the vaccine does not prevent you from becoming infected. It prevents the severity of the symptomology.
Yes.
And so that's what people really need to understand. So if you do get vaccinated, please understand that you can't run out without a mask on and think that you're going to be protected from getting COVID. That's not true. What the vaccine does is it gets your body prepared. So if you do become infected, that you won't have the severe consequences that many people have suffered. Over 300,000 Americans have suffered as a result of COVID complications. So please share that with your friends. Tell your friends the vaccine is not a protective, it's not a shield. It's just a defense to keep your body from having the severe consequences. There's been some questions in the chat room about vitamins. And I know that's been that's very popular going on right now. Vitamin D deficiency has been identified in a significant number of people that have had COVID-19, especially amongst Black Americans. And then there's been a kind of a groundswell of people talking about taking a cocktail. I do it myself, so I'm going to be completely transparent. Every morning when I eat my breakfast, I take my vitamin D, I take my vitamin B complex with zinc and vitamin C to make sure, just so I'm covered. And so what are your thoughts about the vitamins and their relationship to COVID?
So I'm guilty, So I went and got me one of these sort of combo products, immune support, right?
Yeah.
Where it has some echinacea, it has some zinc, it has some vitamin D. So anything, I've been drinking green tea. There's a green tea on the market that's very high potency in terms of its antioxidant content. So I've been drinking 2 packets of that. Anything and everything that you have looked and found has some data to support your immune system. I mean, listen, it can't hurt. I know that. I never encourage anyone from taking vitamins, minerals. And the reason why I don't discourage that is because our foods that we're eating are really vitamin and mineral deficient.
Right.
So many processed foods. Very few people are eating vegan or eating raw. So because of that, we're not getting the proper amount of vitamins and nutrients that we need to have to support our immune system. So I'm a strong believer in that, especially when you start getting into your 50s, your 60s, 70s, and 80s. I think that's when you start seeing your immune system not be as robust as it is when you're in your teens or in your 20s. The reason why the people with diabetes and hypertension have the higher risks of those complications is because diabetes actually affects the ability of the immune system to be able to be at its highest functioning. So it cannot necessarily exert that robust response if in fact you get a COVID-19 infection. So that is why people with diabetes definitely need to, use those ways to boost their immune support, and certainly vitamins and minerals can't hurt that.
Absolutely. So we're really talking about finding ways that there's not a silver bullet, I guess, so to speak. There is multiple things. So if you are wearing your mask, you are social distancing, you are washing your hands, that is one of the methods. You are taking your vitamin supplements to boost your immune system, changing your diet, eating healthily, making sure you get proper rest. Y'all don't understand what rest does to help our bodies prepare itself to be bombarded with bacteria and viruses every day. We are exposed to a number of bacteria and viruses every day. And having a healthy immune system by proper rest and eating healthy will help defend you from that. So there's not one formula. And then the vaccine also helps as well, because this is a new virus in our society. So the vaccine gets your immune system prepared for if you are exposed to COVID-19. So all of those things are important. There's not one silver bullet, one magic elixir that we can take to prevent us or to protect us from COVID. Unfortunately, because if there was, I would be first in line to take it.
All of us would.
I'm so tired of COVID. And I think it's important for us to say that. I think, sometimes we get caught up and tense and say, oh, we gotta be robotic about it. No, we can let our hair down. We can talk about it and be transparent about it and say, look, I'm tired. I'm tired of COVID. I'm tired of having to have 2 masks in the door of my car because I need to know. I need to put a mask on every time I go somewhere. I'm tired of having to wash my hands because they're so dry, and I got to keep lotion in my car because my hands are dry because I'm washing them all the time. I'm tired. I'd like to go to a football game. I'd like to go to a party. I'd like to go somewhere and feel safe. But until that day comes, and until we are all moving, until at least 70%, and that's my next question for you, Dr. Coleman, 70% of us are in a safe space, we won't be able to get back to those things. And so I'm going to do what I need to do. I'm going to do my part to make sure that we can get back to the way things, were somewhat. So,
Yes.
The concept of herd immunity has been thrown out by Dr. Fauci, among others. And could you help our audience really understand what herd immunity is and what it does for our population?
Yeah. So, this concept of herd immunity is that there will be so many people that will be exposed to the contagion, right? To the virus, or if it's influenza. So many people have been exposed to the contagion. They have all mounted an immune response. All right. And so because all of us have been exposed, then the virus won't have anywhere else to go. It basically sort of snuffs itself out like a fire if you have enough people that have been exposed to the particular contagion. The issue is that number, and Dr. Fauci just said a few days ago, he was down at about 70%. Now he's drifting up a little bit closer to 85%. So that means that we must get this vaccination, because it would take potential years for us to get to 85% of 330 million people,
right,
to get exposure to this contagion, to this virus, and so that we can snuff it out. So we cannot get rid of this virus by exposing the whole population to it, because this is the reason why. In that exposure, if that happens, then there will be casualties. That is going to happen. So the people who don't have a good immune system, people that have immunocompromised diseases like lupus or arthritis or cancer or HIV, any disease state that has compromised the immune system, those people are vulnerable to dying. And so if we try to do this through herd immunity, our death rate will be astronomical. And I just don't think that that's an acceptable thing that we should even think about. So what we have to do now is get the vaccination. And you know what? I really want to encourage your audience. Let's just deal with our families and friends. Can we just talk to all of our family and friends? And if everybody has their family take the daggone vaccine, then we can get to, where we need to be in terms of this 85%. And Dr. Fauci, 70 to 85% that Dr. Fauci's talking about. That is so important. But listen, I'm tired. You were talking about you're tired of this thing? Okay, I'm tired. All right. Y'all are really messing my whole thing up here, because I need to get on an airplane and go somewhere. And I need to get on a cruise ship and cruise somewhere. So I need everybody here to help me do that. All right. We need to get this thing done. I don't want to talk about this anymore. And 10 years is ridiculous. I can't do this. I'm going to have to leave the country if you guys do this to me. I'm serious.
So there was a question that asked, so they said that there's been a push, and I hadn't seen this, but they're saying there's a push for people to take Tylenol instead of ibuprofen with regards to the vaccine, or just in terms of if you're having some symptomology. It says, what is the push to take Tylenol instead of ibuprofen right now during the pandemic? Could we explain why that is?
I'm personally not aware of what the data is that would justify that, because if it's for anti-inflammatory processes, then obviously ibuprofen would be the most helpful thing. If it's just for pain and for prevention of fever, then either of those, but Tylenol would be the most commonly used. So I'm not aware that there's any data to suggest one is less preferable than the other. And I was just on that quickly. We have to really be careful, because myths pop up really, really quickly around this. And people start spreading things. And that's unfortunately one of the downsides of social media. Stuff comes up and without any validation. We see that in the presidential thing, but we won't go into that. But we have to really attack these things.
Georgia Blue. We flip Georgia Blue, so we can talk about But yeah, you're absolutely right. I think that, and it's hard as working with a lot of medical professionals in this job that I do, that we understand that we're just trying to get a grasp. For the medical professionals I talk to, they're just trying to get a grasp on trying to understand this particular virus and this disease and its course and its treatment and trying to prevent it. And then these myths pop up and they feel the need to address it because you don't want it to spread and become bigger than what it is. And so now you kind of got all these balls in the air. You're trying to squash myths while you're trying to learn more about this virus so you can give people the right information. But the reality is we're still learning about this virus.
Yeah.
It's been just about a year. It hasn't even been quite a year yet since it really taken hold. So we do have to give people the context, give medical professionals the context that they deserve in order while we're still learning about this virus.
And I think that's why what you're doing here is so absolutely important. And I commend you for it so much, because there's so much we don't know. It's all right as a healthcare provider to say in response to a question, you know what, I'm not sure what the data is on that particular thing, but what I do know is this, and re-emphasize the important stuff that we do know and what's important for patients to know to protect themselves. And that's where we should really put our focus.
Right. So I want to say in here, for now, so I'm going to give each one of you kind of a last statement that you'd like to make for our audience as we wrap up here. Thank you all for joining us as we've been talking about Tuskegee and COVID and implications today with Dr. Gavin and Dr. Coleman. So I'm going to give ladies first. Dr. Coleman, you have the floor.
Well, again, thank you so much. I really encourage your audience to go to HOVhealth.com. In our video on demand section on the website, we have a lot of really educational videos, some of which are on COVID. And as we continue to work with Black Doctor, these kinds of videos that they're producing will also be available on my website. Please sign up for our Facebook page, for our Instagram page, subscribe to my website. I have a number of articles that we'd love you to do. Again, HOVhealth.com. Again, that 800 number is 800-788-0941. If you hear something, you see something, you read something, and you're not sure, please give us a call. If we don't pick up the phone, we will call you back and give you our best estimation of the literature as it stands right now. We want you to have the facts. I think it's important that right now for the next 6 months that we do the mask wearing. We're going to do our social distancing. As soon as you can get the vaccination, please sign up immediately. And let's just do this, one family at a time. I'm going to make sure that I encourage all of my friends and my family to sign up as quickly as they can for this vaccination. And if each one of us do that, then we can I think we can have maybe by the summer, things may be a lot better and at least closer to normal than we are today.
Dr. Gavin.
Yeah, I would simply second what Lenore has said. Remember that we now have credible sources of information like HOV Health, like blackdoctor.org. We have the Black Doctor website. And these are gateways to the sources of the most reliable, up-to-date data. And use that, please, to stay informed. And remember that the vaccine is a powerful tool, but it is not a cure. It is not a treatment for the disease. It is a way of making sure that the infection from this virus will not make you sick or sicker or kill you. And it will prevent the spread to other people. We still have to do all of the other public health things that are important to protect us who are particularly vulnerable to getting sick and dying from this serious pandemic. So the lessons are on the table. Learn from the history, apply it to the present, and make sure that we do all of the things that are now recommended as the most important safety measures to protect our health, the health of our families, our friends, and our children.
Thank you so much. And I would just say, as we're wrapping up here, one, thank you all for joining us. Two, be careful about seeking affirmation and not information. And I'm going to say that one more time. Be careful about seeking affirmation, and that is trying to find stuff to support what you already believe versus information. And information is what is true and factual. So please be careful about that. Understand where your own biases lie and seek that information to make sure you have a good balance and robust information available to you. Also want to say that tomorrow evening, we're going to continue this discussion here on blackdoctor.org at 7 p.m. Tomorrow, we're going to be having our Make It a Plain series continue. We are going to have an interview with Dr. Fauci. We will be on Black Doctor again tomorrow evening. We will also be interviewing with Dr. Kismekia Corbett, who's the black female that has been credited with developing one of the vaccines that is being in use right now. And we have a number of healthcare officials. We've got the president of the NMA. We've got the president of the Black Nursing Association, among many, many others, people that are working on Project Warp Speed from the CDC, and a host of other people that will be on our program tomorrow evening at 7 p.m. here on blackdoctor.org. So you can come see it for yourself. Get all the information. Arm yourself with facts so you can protect yourself from the misinformation that is circulating out there on the web. Again, I want to thank Dr. Lenore Coleman and Dr. James Gavin for coming and joining us in the middle of the day. They didn't have to, but this is an important subject for them to come here today, and it's important for us to get all the proper information to you and to your family so you can share it with your friends. So this is going to be housed on our YouTube page. So if you want to share the YouTube link with your friends and family on your page, you're more than welcome to do that. Please, please, please go to blackdoctor.org. We have a whole page dedicated to COVID, giving you all the latest information available to you. You can go to HOV Health. There's a number of places that you can go to prevent COVID. The Coalition for Blacks Against COVID. There's a number of people and organizations dedicated to keeping Black Americans safe, keeping Black Americans healthy. That's why we're here. We're trying to keep us safe and healthy and happy. So health is your biggest asset. Please, please do everything you can to protect it. Thank you all, and have a good afternoon.
All right. Thank you.
Thank you.